Hi, everyone. Thank you so much for joining us today. So I have a couple people from my team here as well. Ben and Robert are here. So between the three of us and Richard and Serena over at drchrono, we're hoping we can get as many questions answered as you guys have, both about MACRA and about some best practices and things that you can be doing in drchrono. So just a quick overview of what we're going to be talking about today. We are going to do a little bit of a deeper dive than you might have seen if you've been on one of our webinars before into what is MACRA, and reviewing kind of what happened to the older programs, meaningful use and PQRS. We'll also go into some more detail about your best practices for MIPS compliance and make sure that you guys understand what you can be doing throughout the year, and then we'll give you kind of a quick overview of how drchrono and Healthy Filings can help support you and leave plenty of time at the end for questions. So we're going to start with some key terms that are really important to know. One of the things we hear a lot, there's some confusion, what is MACRA and what is MIPS? So MACRA stands for the Medicare and CHIP Reauthorization Act. MACRA is actually the legislation, that put the MIPS program into place. So you'll hear the term QPP, which is the Quality Payment Program. Under the QPP, there are two ways that you can comply. There's MIPS, which is the Merit-Based Incentive Payment System. Most providers, about 95% of providers that have to comply, will comply under MIPS. And then there's also an APM, which is an advanced alternative payment model. But like we said, most providers, especially providers under drchrono, most of you are going to have to comply under MIPS. So your MIPS score is what's known as a composite performance score. So under MIPS, providers receive a score out of 100 points. So previously, when you were reporting under a few different programs. For MIPS, you're reporting one program that gives you one score in 3 different categories. So you have your quality category, which replaces PQRS and the value-based payment modifier programs, and that's worth 60 points of your overall score. Advancing care information, which replaces meaningful use and is worth 25 points, and improvement activities, which is a new category, and that's 15 points. And we'll go into some detail about what each of these categories are in a little bit. So why are these programs changing? There's a lot going on, in healthcare these days, but really, the crux of why these programs are changing is because CMS is shifting from a volume to a value-based care model. So basically, CMS has said, they're not just defining what quality care is, but how they want clinicians to deliver that care. So thinking about 3 of the things that CMS wants you to focus on: improving outcomes, managing costs, leveraging technology. Everything you're going to see with the MIPS program and the quality payment programs, that's all centered around those 3 ideas and making sure that providers are meeting those goals. So a couple of really important things to keep in mind with MIPS that are a little bit different from your previous programs. Under MIPS, all scores will be made public through the star rating system. So that means that whatever your MIPS score, your CPS score winds up being, that information is going to be publicly available to any patient who might want to visit your practice. Additionally, this really makes it important that all healthcare clinicians, all healthcare organizations have to really evolve their approach under this new standard. To make sure that both the reputational and financial impacts are not too significant. So CMS reporting changes. So for most of you, you may have reported under the 2016 programs already. There's still a couple of weeks left if you haven't done that, but so you might be familiar with some of these terms. So in 2016, what you had to do, you had to report, as I mentioned, under 3 programs: PQRS, the value-based payment modifier, and meaningful use. Almost all Medicare Part B providers had to comply in 2016, and there were a couple of different options for reporting. you could report through your claims, through a registry, or through a data submission vendor. And that deadline is March 31st of this year. So like I said, if you haven't complied yet, there's still a little bit of time left. In 2017, this changes a little bit. So what you're getting is you're now getting, like we mentioned, one report or one program to report under scored across 3 categories. So again, you have your quality category, which replaced PQRS and the value-based payment modifier, advancing care information, formerly known as meaningful use, and then this new improvement activities. Now, most providers that had to report in 2016 are going to have to report in 2017, but there are some notable exceptions. One of the most notable exceptions is therapists. So physical therapists, occupational therapists, speech therapists, anyone who falls into those categories, they will not need to comply in 2017 or 2018. But additionally, Part B providers, so if you do fall in the realm of having to comply or of not being one of those excluded categories, if you do not meet the low volume thresholds, you will not have to comply under MIPS either. So those low volume thresholds are 100 unique Medicare patients and $30,000 in annual Medicare billings. And you're going to have done both of those things. So you'll have to have seen 100 unique patients. So I want to stress that it's not 100 Medicare patient visits, but actually 100 separate Medicare patients. And also make sure that you have billed $30,000 in Medicare over the course of the year. The main reporting options for MIPS in 2017 are through a registry or through a certified EHR technology, which is formerly a data submission vendor. So you've probably heard a lot of talk about picking your own pace and how to comply and how to report and the length of time that you need to report. So there are multiple options for reporting. You can report the full year, which means from January 1st all the way through December 31st. But everyone needs to report a minimum of 90 contiguous days. Or you can report a minimum of 90 contiguous days, or submit one measure. Even CMS now is coming out and saying that really the best thing that you can do is to report as much data as possible, and they're really recommending that you report for the full year, even though they are giving you some other options if you don't feel ready for that. And again, the submission deadline is March 31st of 2018. So why is CMS, why are most people recommending that you report for the full year? That really has to do with the financial implications. So the easiest way to think about it is that the Medicare fee schedule has changed from fee for service to pay for performance. So what does that mean? That basically means that if you think about it in the context of $1, what you might have been reimbursed $1 for previously, now CMS is saying, well, we're really only going to give you 88 cents. And the rest of that money is going to have to get earned back in how you perform. So the better you perform, the higher you benchmark, relative to your peers, the greater chance you are going to have to earn back, the rest of that money that you would have gotten previously. So for the 2017 year, this is how basically this shakes out. So if you do not comply, if you say, what, we're not ready for MIPS, we're not going to report this year, you're automatically going to receive a 4% reduction. If, however, you comply even just a little bit, CMS is saying, the bare minimum is to submit one patient, one measure, that's going to give you a 0% reduction, but it's also going to give you a 0% increase. So again, if you think about it, you can't think about it as just, you're not really receiving that reduction. That fee schedule has changed, so you're also not giving yourself the opportunity to earn back any of that money that you would have received previously. If you do choose to report a little bit more information, and like I said, most people are recommending the full year, you have the opportunity at 2 separate payment adjustments. One of them is up to 12%, and that comes with, like I said, reporting as much data as possible and is based on your composite performance score. If you receive a MIPS score between 70 and 100 points, you fall into what CMS is referring to as the exceptional performance category. There is an additional 10% bonus for anyone who scores within that range, or you're eligible for a bonus if you score within that range of up to 10%. This is a fixed amount of money, so kind of depending on how many providers perform and how well you perform is dependent on how much you're actually going to get in that area. So a little bit more detail on the MIPS scoring. MIPS scoring is pretty complicated, and we know that there's a lot of questions surrounding this, and kind of what this means for you. So the quality category, like we mentioned, is out of 60 points. So again, this replaced PQRS and the value-based payment modifier. So you're going to be reporting those quality measures similar to how you would have reported quality measures in the past. This year, you're required to choose 6 measures, including 1 outcome measure or other priority measure. So to set yourself up for success in the quality category, it's important to understand how the scoring works, which means knowing that there's an increased emphasis on benchmarking against your peers. It'll be really important for you to identify and select those high priority measures, and in the future, eliminating measures that top out if too many people reach 100%. So we always like to explain it to people as, sometimes it's better for you if you submit a measure where you're performing at 80%, but everyone else is performing at 50%, than to submit a measure where you're performing at 100% and everyone else is performing at 100% as well. MIPS really, especially, is really focused on how you do relative to your peers. So if everyone is doing well, you're not gonna, and you're one of the people who's doing well, you won't do as well as a measure where you're doing fairly well and everyone else is doing not so well. So advancing care information, this replaced meaningful use, and there's 100 points allow you to receive full credit in this category. And this is based on a base score of required measures and a performance score of measures where you can pick and choose from. So there's some that are all or nothing in this category, and some where you can choose what measures you would actually like to select. Those performance measures are benchmarked similar to how things are benchmarked in the quality category, and we'll go into a little bit more detail about what that looks like later. For the improvement activities, this is worth 15 points. There are 92 activities in this category, but you only need to report on 2 or 4 of those activities to earn full credit. And it's important to make sure that you're doing these for a minimum of 90 contiguous days throughout the reporting year. So I'm going to delve into a little bit of best practices here and talk in a little bit more detail about some of the MIPS categories and what you can do, sometimes specifically within drchrono to make sure that you guys are staying on top of MIPS throughout the year. So the quality category in drchrono is similar to how you have been tracking this information up until now. It's really important to know that within drchrono, some fields for this to track information for the quality category are auto-generated and others are put in manually. And I'll show you some specifics on the next slide. So when I say auto-generated, what we're talking about are fields that are most likely part of your normal workflow. They might be a billing field or lab orders, medications, things like that, whereas other fields need to be put in manually. It's important to note that whatever field they are, whether it's an auto-generated field or a manually populated field, that all of these must be put into predefined drchrono fields. So not custom fields that you've created, but actually predefined fields. So we have a couple of examples here. One of them is CMS 122, which is diabetes hemoglobin A1C poor control. So this measure is entirely based on standard documentation, meaning fields that are auto-generated based on what you're inputting into drchrono. So for this measure, the patient would need to have a history of diabetes. There would need to be demographic information. They'd need to be within a certain age, over 18 but under 75. In your billing, you would want to bill for an office visit, face-to-face encounter, preventative visit. There's a whole slew of different types of visits you could bill for, and then order that lab test, that HbA1c laboratory test with a result. Now, on the flip side of that is CMS 138, which is a smoking cessation measure. So for that measure, you are going to document some things just as you normally would. Demographic information, billing, and the patient's smoking status. But actually on the patient's CQM page, which I'll show you on the next slide, you're going to need to manually enter that intervention for smoking and tobacco use cessation. So what does this look like if you're looking within drchrono? So, as I mentioned, some of these fields are auto-generated and others are put in manually. So anytime you access a specific patient within drchrono, on the left-hand side of your page, you're going to see a column. And down about 3/4 of the way down that page, you'll see something that says CQMs. The more information you have on this page, the more CQM data you guys are populating regarding your patients. So for some of these fields, sort of the ones that start where it says condition, diagnosis, problem, those are your auto-generated fields. So if they have something in gray in parentheses next to them, that means that information is coming in automatically from where you're entering it in elsewhere in drchrono. So that would be, things that are coming from your problem list, from your billing, medications and prescriptions, from lab orders. That information is all coming in here, based on what you're doing during your visit. The other information on that page that's still equally important is intervention, risk category and assessment, your physical exam, and communication. This information that gets entered here needs to be entered manually on this page. So for example, if we go back to that example of the smoking cessation, if you as a provider are meeting with that patient and counseling them about smoking cessation, and you're putting that information into the patient note, but not putting it here on this page in that screen, it's not going to count that patient for that measure. That information needs to be entered on this page. So however you wind up tracking your CQM data, the more information you put on this page, the better data you're actually going to have. So that might require some changes to your workflows in order to add those steps in, but that's really important. To get as many patients and as much data as you can into these fields. The more data you have, the better your scores are going to be. I'm going to pause for a second here and just see if anyone has any questions about that, because I know I just gave you a lot of information about drchrono. So if you guys have questions, you can enter them into the question box. Otherwise, we'll just move on to the next slide, and we'll take more questions at the end. Okay, great. So like I said, if you guys have questions, please type them in, and we'll either answer. Oh, someone does have a question. How do you get to this page? So Serena, do you want to give a little bit of an explanation to customers about how you actually get to this page? Or we can save this to the end, and you can actually screen share and show people.
Yeah, so on the computer, all you have to do is go to the patient chart, and you can access that by typing in the patient name into the patient search bar in the top right-hand corner of your drchrono page. And then once you get into the patient chart, on the left-hand sidebar, where you normally have demographics, problem list, medication list, allergies, etc., Down below, you'll see there's a CQMS section on the left-hand side between drug interactions and intake data. So all you have to do is go to the patient chart, click on the CQMS section of the patient chart, and then enter in, for instance, from this example, the intervention. And we can show this later on screen share if you would like me to demonstrate that on my screen.
Thanks so much, Serena. I appreciate it. So I think that's all the questions we have specifically about this. So we'll move on to the next slide, and like I said, if something comes to you, we will certainly address more questions about this towards the end. So advancing care information, there's a lot of confusion around, do we still have to report meaningful use? Are we not reporting meaningful use? Meaningful use in its initial stage doesn't really exist for Medicare anymore. This advancing care information replaced that requirement. So the ACI category is based on modified stage 2 meaningful use measures for EHR certified to 2014. For you guys, what you need to know is for right now, drchrono is certified to 2014. So in 2017, you're going to be reporting on those modified stage 2 meaningful use measures. So one of the things that's really important to note about this category is that the all or nothing meaningful use compliance does not exist anymore. So there's this score, or this category is based on two separate components. One is all or nothing, and the other one is a performance category. The other thing that's important to note is that the ECQM requirement is now covered by the quality category. So depending on how you submitted information this year, you might have had to submit your PQRS data and then also go in and submit electronic clinical quality measures when you reported meaningful use, but you won't need to be doing that going forward. There are some bonuses available in this category as well, and that can be made by reporting to public health registries or by using a certified EHR technology. And we'll talk a little bit more about specifically what that is in a little bit. So there are also no more exclusions. So previously, if you noted, depending on certain things that had to do relative to the category, so if you're a provider who never ordered radiology tests, you wouldn't have had to submit the radiology requirement for meaningful use. Because there is flexibility in reporting the performance measures, there are no longer exclusions under any of these measures. So your base score in this category is out of 50 points, and for modified for transitional measures for 2017, there are 4 objectives that have to be met. You will have to meet all 4 of these objectives in order to obtain any points for the ACI category at all. And then your performance score is calculated based on a decile system similar to the quality category. And there are up to 7 activities you can report. Again, the goal here is to get to 100 points. Once you hit 100 points, whether you hit 101 or 135, you're going to earn the full 25 points in this category. So this slide gives a little bit of detail about what the reporting requirements are. So your base score, like I said, is made up of 4 measures. These measures should look very familiar to you. E-scribing, patient access, security analysis, summaries of care. These are all things that you guys have already been doing under meaningful use. Now your performance score measures are measures that relate to basically the quantity of times that you are able to do this, which has to do with patient-specific education, for example. How many times when you met with a patient did you actually provide educational materials, related to a condition that patient had or something else? How many times were you sending secure messages to patients, and how many times were you using that secure messaging through the patient portal? Things like that. Because this is out of 90 points, some of these are weighted a little bit heavier than others. So those two highlighted measures at the bottom, providing patient access and sending summaries of care, those are weighted a bit more than the other measures in that category. And again, you do have a few options to earn bonuses if you're reporting to any of those public health registries, or if you're using a certified EHR technology to track your improvement activities. So improvement activities is a new category. The important thing to note here is that you must track these for a minimum of 90 contiguous days. So if you fall short of the 90-day window, you will not be able to earn points in this category. For providers who, or for groups who have fewer than 15 providers, 15 or fewer providers, or those who work in critical access hospitals, you'll only need to report 2 improvement activities. For everyone else, you'll need to report 4 activities. So there are 9 separate categories for activities, and you can see below how many activities there are to choose from in each of these categories. The thing here that's really important to note is that CMS, and you can see this kind of based on the number of activities under each category, is really focusing on patient engagement, care coordination, and patient safety practice assessment. That goes back to what we were talking about earlier. CMS really wants you to engage with your patients, to coordinate care. If you're sending your patient, if you're referring your patient out, that there's follow-ups there, that you're tracking that information and making sure that that care is coordinated even when that patient isn't being seen solely in your practice. So anytime you have the opportunity to engage in activities that are in pursuit of those goals, that's going to help ensure your complete compliance in this category. So I'll talk really quickly a little bit about Healthy Filings and drchrono and how we can help support you, to make sure that you're fully covered for MIPS. So just a little bit about us, Healthy Filings. So we are, our software is an ONC certified health information technology, and we're certified in all 64 clinical quality measures. So there's quite a bit of variety there to find measures that are relevant to your practice and make sense to your practice no matter what kind of provider you are. We are fully HIPAA compliant. As of January 1st, Healthy Filings is considered a certified EHR technology. So I mentioned really early on in the webinar that CMS has changed how they're referring to us. They used to refer to us as a data submission vendor, and now we're certified EHR technology. So CMS does refer to both EHRs and the technologies that work with EHRs as certs. But a good example is, drchrono, your instance of drchrono is a certified EHR. They're an input for all of your, all of your data, all of your patient data is going to go right in to that EHR. Healthy Filings, on the other hand, is a certified EHR technology, which means we're there to extract that data and we're going to provide analytics and reporting. So drchrono is, is the input, and we're the output in the analysis side of it. So drchrono does an excellent job of setting you guys up and providing you with a framework for CMS compliance. Like we showed you, the input for those quality scores, tracking for, for meaningful use, that's all within drchrono. But what our services do is we complement that, and we're able to help you track, monitor, and manage, and ultimately submit that required data to CMS. So how exactly does that work, and how exactly do we do that? So for the quality category, we have software. Our algorithms are going to select and benchmark those measures to maximize your score and to help optimize your eligibility for that exceptional performance adjustment. So, when we were talking about scoring, there's quite a few things that you need to take into consideration. That's a pretty challenging thing for humans to do on their own, but that's something that our software is able to do. And we're going to take that information directly from drchrono, and that will require no IT or administrative support on your end. Plus, CMS is going to give you a bonus of 1 decile just for using our services, because we are that certified EHR technology. And like we mentioned earlier, CMS really does want you to focus on leveraging technology where you can. For ACI, again, our software is going to do the work to track and submit this information to CMS on your behalf. So we will go into drchrono and pull all that information out and then ultimately report that for you. And again, you're going to earn a 10% bonus in this category just for using our services. So for the improvement activities, our QM Accelerator, which is an interactive dashboard tool, that satisfies 4 of the activities. So whether you need to report 2 or 4, we have you covered in full for that. And that's really focusing on that patient engagement and that care coordination. You know, we're happy to kind of show you a demo of our services if that's something that you're interested in, but that's going to really help you drill into, you know, all the way down to your patient level and help you kind of see where things might be falling short and where you can make improvements, which again is really something that CMS wants you to focus on. So just by, you know, signing up and using us, you're going to achieve all the points necessary to avoid any MIPS penalties there. So I am going to stop there and open it up for questions. I know we've gotten quite a few in already, so we'll field those and we'll make sure that the right person with the right information answers those for you. So as the questions come in, there's just one more point I want to stress. You know, working with drchrono, our integration is really seamless. We have a pretty easy connection with drchrono. We've set that up, so all you really need to do is sign up for our services, click a link, and you're ready to go. That's a really great testament to, you know, the ease of using drchrono software and how we work together. So if that's something that you're interested in, it's a pretty easy, seamless transition.
What are the costs? Okay. What are the costs associated with? Okay. What are the costs? Just say.
So what are the costs associated with using our services? So I'm going to let Robert answer this question. It kind of falls into his expertise.
Good afternoon, everybody. So here's the short answer, which is that there's not a standard sort of rate per. So based on the number of EPs within your practice, based on the duration of the service agreement, in conjunction with which of the services you feel are going to optimize your use of drchrono, along with being able to maximize your MIPS score and then handle the reporting, that will drive kind of how we quote this. But I think you know, the best thing to do is to get in touch with either your account exec at drchrono or Stacy and give us the, you know, the answers to those few questions, and then we can turn around sort of a quick quote for you on that. So, and that's generally how we handle all that.
Yep.
Stacy. Yep.
Yep. And my contact information is up on the screen, so feel free to reach out to me directly.
This looks like a question for the drchrono team. It's asking, is there going to be a new version of the drchrono platform?
Yeah, so I guess in terms of this question and in terms of this webinar, this is Richard, by the way. drchrono is working on certification for Meaningful Use Stage 3, and that is going to be on its way very soon. No fixed deadline right now, but we're shooting to have that done this year for sure. If you have any additional questions regarding that, I'd love to clarify what your question is. But yeah, we're constantly updating the platform more and more every day. But with our partner, Health eFiling, for anything that's related to MACRA, I feel very confident. We feel very confident that you'll be able to perform to the measures outlaid by MACRA.
Is there another one there, Ben?
Yeah.
Oh, yep, here it is. Okay. Okay, got it. So the question here was a clarification around sort of pick your pace slash 90 contiguous days. And again, so this is a good question because we'll have to clarify this. They're asking, do you do the measures just for 90 days, or should you be focusing on improving your measures for the entire year, is essentially what the question is trying to get at.
Yeah, that's a great question. So our recommendation is to focus on the measures and improving your measures and improving your scores for as long as possible throughout the year. We understand that, a lot of people are thinking, well, it's March, can I really, report for a full year if it's already March? The answer is, in the spirit of things, the way we're interpreting it, yes, you can. We're still in the first quarter of the year here, so you can certainly still look at your information from January at this point and make improvements. So there are some requirements, like for the improvement activities, where you need to be tracking those for a minimum of 90 days in order to earn any points. But our recommendation, as well as the recommendation that's now coming from CMS, is that you track information in as many of the categories as you can for as long as you can.
Great. And the questions are flying in, so we'll keep moving on. So the next one is, where is the CQM window in the drchrono mobile app?
That's a great question for Serena.
I'm checking with my team right now to see if there is an available place to put that in on the iPad. I do know for sure there is a place on the desktop to enter in, like I mentioned in the patient chart. On the left-hand side, there's a CQM section within the patient chart. And I'm checking with one of our meaningful use specialists right now, as she's more familiar with that documentation. And so I'll post the answer in the question list once I receive that answer regarding the iPad.
Great, thank you so much.
Terrific. Okay, the next question is, how can we record our performance? And I think building on this, maybe this is a combination for both Healthy Filings and drchrono to answer. My sense is, from looking at the questions, because there were a couple in this area, I think they're trying to get a sense for how do they know how well they're doing based on what they're inputting into drchrono. So they will know what their performance is and/or where they can continue to focus to improve performance throughout the year in order to optimize the MIPS score.
Yeah, absolutely. So I'll start, and then Serena, please jump in. Throughout the year, drchrono tracks and is certified to track a certain number of the CQM, the clinical quality measures. I believe it's 13 measures the last time I looked. So, and Serena can actually show you where this information tracks. She can do a screen share there. Serena, you can go ahead and show people that if you want. But to just go into a little bit more detail, on the Healthy Filing side, we can help you track all 64 of those measures. So if you have access to our dashboard tool, you'll be able to see updated on a monthly basis where you're tracking across all 64 measures. So Serena, I'm gonna pass this to you, and if you want to show people where that information tracks in drchrono, that would be great.
Okay, can you all see my screen here?
Yeah, we can see your screen.
Okay, and just to refresh, was the question specifically regarding CQMS or?
Yeah, so the question was regarding how they can see their performance throughout the year. So, like on this page, they can see kind of what they've been tracking, but drchrono also can show them, where they're performing throughout the year as well. And
right.
I think people want to kind of see exactly where that is.
So here under the clinical tab, we do have some resources available for you. Down below for meaningful use reporting, we do have your CQM section where you can check that on a kind of longer term basis. And so from here, you can see all of the different measures, which ones are recommended, and on the right-hand side then, minimize this. Here on the right-hand side, you can calculate how you're performing, and this will pull based on what you've entered into the specific patient chart and within your drchrono account. So here you can just go down the line, calculate, and it'll show you how you're performing based on what are the requirements, and then you can see maybe where you need to target a little more effort to complete that documentation. Does that answer your question?
Yes, I think that covers.
I think that covers it. Thank you so much.
You're very welcome.
So, Serena, let's stay with this though for a second, because there was another question that came in, and I think this is more about clarification. So, and again, we'll let the drchrono team also jump in on this, but just to be very clear, the current version of drchrono, the platform you have and are using, is ready to go for purposes of 2017 reporting and enabling compliance with MIPS. So, Richard or Serena, you may want to elaborate a minute on what's to come, following up on the previous question that Richard just answered. But just to be clear, everybody's good to go with what you have. And so as for starting to kind of do what you want or need to do under the MIPS program in order to maximize your performance and track it, as Serena was just showing you could do here in drchrono as well, you want to start now. You're ready to go. You've got the right tools, in front of you to do it. You don't want to wait. You want to start now. So just to be very clear, and with that, I'll see Serena or Richard if you want to elaborate at all relative to, again, the clarification about future versions of drchrono versus the functionality of what they have today.
Absolutely, absolutely. This is Richard again from the marketing team. So, looking at the screen that we have right now that we're sharing, we do have some of the CQMs, but obviously not all of them. However, here is not where you need to reference if you are trying to test for MACRA. The data fields that Healthy Filing are pulling from are inherent within the templates already that you have standard with any drchrono account. Any changes that are going to be happening to drchrono are just going to build upon this so that you're greater enabled to be able to see what's going on and to use the functionality of drchrono. One good example that Rob gave to me a little while back was, with meaningful use, you're looking out the rear view mirror, and with MACRA, you're looking straight out the window, trying to look ahead. There are a lot of changes that are happening, a lot of things that we're not certain about, but for what we have right now, in terms of MACRA, not meaningful use, Healthy Filing and drchrono together have everything that you need to meet pretty much every single performance requirement and to perform at your best as well. Healthy Filing and drchrono together, we're able to support you through this process of attesting and really measuring the performance period of at least 90 contiguous days that we're hoping that every provider on drchrono can do. Hopefully that answers the question. In terms of being meaningful use stage 3 ready, that's something that we're shooting to have done hopefully by October, if not earlier than that.
Hey, Richard, if you would, just build on what you've just shared, and I think it's a question. It's more about clarification. A couple of questions have come in that said that something was distributed from drchrono, which said that drchrono would not be able to support MACRA programs until June of 2017. It seems like that's where some of the questions are centered around as well. Maybe you want to just clarify that.
Right. So that posting from a little while back regarding June 2017, that was what we were planning on having our attestation for meaningful use stage 3 completed by. That date has been pushed back a little bit. We are working on some features that are helping out most of our specialties and improving the functionality of the product. We felt like that was the right thing to do because we know that Healthy Filing is able to do all this for us as a platform, a standalone platform for ad testing for MIPS and underneath MACRA. Yes, this does stand true that for the attestation for MACRA, if we were to use drchrono alone, this isn't something that you might be able to meet the extremely minimum requirement that we talked about earlier on in your presentation. With Healthy Filing, we're very confident that you're going to be able to meet not only the minimum, but get to the maximum increase in your payments through Medicare. Hopefully that puts the question at rest, and you have the confidence to move forward with attesting for MACRA.
Yeah, thanks. Thanks, Richard. I'm going to build off of that a little bit, and also, we've gotten a couple of other questions. So, so the thing that's really important to note is for this first year in 2017, even if drchrono today were certified to those stage 3 measures, you can still report the transitional measures, and that's not hurting your score in any way. You're still able to get the same amount of points in that ACI category, just by using those transitional measures. You're just going to be kind of reporting under those transitional measures in a little bit of a different way. But if anyone has any questions about the details about that, I know drchrono has some great meaningful use specialists who can delve into that, and we at Healthy Filings would be happy to to give you a little bit more of an explanation. There was also a question about
Number of questions.
Yeah, a number of questions actually about how this page in drchrono doesn't give you a specific score. It only tells you where you're at. So that's why Healthy Filings is here, and that's why drchrono has a relationship with us. So whereas drchrono is going to give you that that calculation, and they're going to show you that those numerator and denominator measures, Healthy Filings goes in and we're pulling all of your data. So we're going to pull in, sometimes we pull in a little bit more data than calculates here on this page just because of the way that our technology works. That's a system of checks and balances for us and for drchrono. And when it comes to the benchmarking and those scores and really being able to know where you're scoring and where you're performing, that's something that you're able to see in a little bit more detail through our dashboard. So when you use our dashboard tool, we'll show you where you stand relative to the benchmark and also why you're there. So if we take a measure like documentations of current medication in the medical record, for example, if you're coming up as 20 out of 40 patients, we're going to be able to show you kind of that drill into why that is, but where that 20 to 40, that 50% score, puts you relative to the benchmark. So in this way, we really see ourselves as a complement to the information that you're getting with drchrono.
Great, Stacey. And I'm actually going to build on that point because a number of questions have come in. And so between Stacey and the drchrono team, may want to jump in here. They're asking to understand where to put the information into drchrono so that then it's captured, so then when it's pulled out and they look at the dashboard to know how they're doing, that it's all there, that the work they're doing, the inputs they're doing are being captured properly. So sort of where and how to use drchrono to be able to do that effectively.
Yeah, absolutely. And I'll let Serena show this on her screen, but this is kind of a little bit of what we were touching on earlier. The thing that's really important is to make sure that when you're inputting information, you're inputting that information so it populates on that CQM screen. So Serena, if you want to pull that up and show people how to get there, basically when you look at that screen, you're going to see some fields that are auto-generated that come from the things that you guys are doing in your practice every day, entering in billing information, patient demographic information, medications, lab orders, And then some of those things have to be manually entered in as interventions, as risk assessments. Those are generally entered in either by, kind of typing in the name of what that is, smoking cessation, for example, or by entering in the SNOMED code for that, and then it will pop up automatically. This is a great thing if you have specific questions about a measure or why a measure might be tracking in the same way. The account managers at drchrono are always available to kind of walk you through where that is. And if you're a customer of ours and there's some questions about why a measure, looks a certain way, we're happy to kind of, hop on the phone with you guys as well. And kind of, work together as a team to make sure that you guys are getting credit for the work that you're doing.
Yes, and building on what you said, Stacy, there are a lot. This is a pretty big question, and you can have some very specific, situations where you need to document a specific field. And like you're saying, Stacy, some of the information you're filling out in your day-to-day charting, it might just be, the medications list or a diagnostic list, as well as some of those additional CQM measures that you're putting in, such as the interventions. If any of you providers have any specific scenarios where you're unable to figure out why some of the information is not pulling up as you're calculating, kind of the numerator and denominators here, feel free to reach out to your account managers at accountmanager@drchrono.com for any additional help. And we also do have meaningful use specialists who are very familiar with how all of this is built out and where this is exactly pulling information from within your patient charts and your clinical notes. So we can always set up a meaningful use training for you with our specialists, and they work, day in and day out to make sure that all of that data is being captured for you within your drchrono account. So they can give you more of those nuanced answers.
And if I can build off of this a little bit, we could try and give a general overview of how to do this, but this would probably take an additional hour of the 4 minutes of time we have left over. I think if I'm reading into the question correctly, I think it's best if we set up a quick call between you or anyone else who's interested in this to start off with Stacy, figure out what are the specific things that you're looking for, and we can coordinate with Stacy to help set up an additional training specifically for you to go over what fields you need to start populating in order to get this done.
Great. We only have another minute or two left, and there are sort of a few other questions that kind of are around a similar theme that I just want to make sure that we hit on here, which is that a couple of questions were about, well, compliance and what enables compliance, and how to maximize performance under the new program MIPS. So just to be very clear, everything you're doing with drchrono right now enables you to essentially be in compliance with MACRA and the program sort of structure. So continuing to use drchrono as you have, to use it effectively, is the perfect platform for you to then get to the next tier within MIPS. MIPS is all about challenging clinicians to continue to deliver quality care, improve outcomes, and do it cost effectively. And if you do so and can demonstrate that you are, then you'll maximize your reimbursements. Many of the activities, though, that have to be done aren't necessarily things tied directly to, if you will, just having drchrono as your EHR and using that effectively. So you need to be careful to sort of separate out what you need to do in terms of how you approach patient engagement, patient outreach, activities with patients, and then capturing that within the structure of drchrono to make sure you get credit for it. And between drchrono, obviously you're more than capable of being able to capture that effectively, and then Health eFilings is the tool to help you be able to pull that out and report it effectively so you get the credit with it. But your ability to comply is already in your hands relative to using drchrono as your EHR.